Hello. Sorry, hello. Let's do something else then. Hello, greetings. 7 o'clock Tuesday night. That means I'm here. It's Facebook Live. I've got some questions. If you have any questions, please ask away. Ideally, plastic surgery related. That is my forte. So if you've got anything that you want to say, you think you'll find that it says there. It's a live. It's a live Q&A with yours truly. If you have anything to say, please comment. Feel free to comment multiply and share too. Feel free to do both those things. If you are a podcast type person, this is available on iTunes as a podcast, I believe. I'm not sure if I need to tell you more than that. It'll probably be called Staiano Clinic, I'm guessing. And it's on YouTube, which is definitely called Staiano Clinic, and there's a lot more on YouTube. So please go over to YouTube and have a look and subscribe. Click the bell. That's all the proper YouTubers say. I am officially a YouTuber. I have got, I think you'll find 200 and nearly 250 subscribers. Yeah, nearly 250. So I think by all accounts, that is a YouTuber. I don't think anyone could deny that. But nevertheless, we are here. It's now, and this is Facebook, and I've got some questions. If you've got any questions, then you can ask me here and now. But if not, just sit back, relax, enjoy the journey, and we're going to kick off. I'm going to kick off with this one. Is it harder to detect cancer with mammograms if you have implants? I have a cold. Can't shift it. Sorry, I can't a cold. A cough. I did have a cold, probably a week ago. When it gets hot, do you find that sometimes when you get hot, you get a cold? Is that? I'm a doctor. I should know that. But anyway, so good question. Is it harder to detect cancer with mammograms if you have implants? So a lot of people are worried about cancer detection when they have implants in, and it's something you need to be aware of. And I used to just do breast reconstruction for cancer patients who've had mastectomies. And it would not be uncommon if they've, when you reconstruct the breast, you reconstruct a breast to match a breast that the patient likes. So the first question you always say is, do you like your other breast? Because if their other breast is always too big or too small, there's no point in reconstructing a breast to match that, because you can always do surgery to make the other breast bigger or smaller. So it would be not unusual to put an implant in the other breast, the non-cancer breast, in patients with breast cancer. So if there's a problem with detecting breast cancers, you wouldn't be putting implants in people who have got breast cancer, and had a mastectomy of the other breast. So it is fine to do mammograms. It's fine to do biopsies if you have breast implants in. If you have breast implants, it's not that any breast tissue is behind the implants and the implant's not going to hide a cancer. Having said that, it is a little bit more difficult because the people doing the mammogram have to do it in a certain way. They have to do it in a certain angle in order to view the breast tissue. So you need to obviously let them know that you've got implants in. And if you were going to have a biopsy of any lumps, you need to tell them your implants in, because they probably wouldn't put a needle in. If you could feel a lump in your breast, the breast surgeons might just put a needle in and biopsy it. But if you've got implants in, they probably do an ultrasound guided biopsy. So they need to vary how they do things, but it is absolutely fine, and it is not a problem to feel lumps or to investigate lumps if you have lumps in your breast. Breast cancer is such a common thing and such a worry. If it was going to hide that breast cancer, then we wouldn't do it. So it is fine to feel your breast tissue, and you can feel lumps just the same, and you can have mammograms and biopsies, etc., just the same. Good question. Thank you for that. Vaser VS Lipo. Vaser liposuction claims to be less aggressive than traditional lipo and makes for a more speedy recovery with less bruising. Is this true? What are they saying here? Traditional makes for a more speedy recovery with less bruising. Is this true? Full disclaimer: I don't do Vaser. I don't do Vaser or laser. So Vaser liposuction is an assisted form of liposuction, uh, and it is assisted with ultrasound, believe it or not. Can you see that little? Um, there is a laser assisted liposuction, which is not Vaser, but Vaser is ultrasound. So the way they assist the liposuction, the assisted forms of liposuction like Vaser, assist it by delivering energy to the fat before you suck it out. And delivering energy to the fat before you suck it out means that you can use a smaller cannula, means that it is you often do it under local anesthetic and sedation. So there are good things about it. I'm probably not the best person to talk about it because I don't do it, but anyway, I'll have a bash because I do traditional liposuction. So it's always, I think you've always got to be careful when someone tries to tell you one thing is clearly better than another thing, because you've got to ask yourself, why would people do the other thing? So what this patient is saying is Vaser is less aggressive, more speedy recovery with less bruising. So if it was all good, we would all do Vaser. So why don't we all do Vaser? You know, if Vaser's so good, why don't we all do it? That's the question. So there's good and there's bad about everything, about things. So the good thing about Vaser is that it is smaller cannula. It is often less traumatic because it is smaller cannulas, and therefore perhaps your speedy recovery and bruising. I don't know if that's proven, but that's, I could understand that. Um, and the other good thing about Vaser, which is a point that I often point people towards Vaser, is they say, and I've got to say that they say because I don't do it, but they say it causes some skin retraction, which is a big thing, especially in the abdomen. Now, the problem with Vaser, and you might say, well, that's all good. Why doesn't everyone do it? Why don't I do it? The problem with Vaser, or at least my worry with Vaser, it may or may not be a problem, is that in delivering energy to the fat, that heats the fat. And in heating the fat, that is how they report to cause some skin retraction. And the worry is, and you're probably going to say I'm old fashioned because it's going back a bit. You worry about delivering thermal energy and heating the fat and causing burns and maybe causing more problems with paresthesia and things like that. So that's my worry. Because you're delivering energy to the fat, you've got potential for other sorts of complications. Although the good side of it would be that you use a smaller cannula, and there may be less, a quicker recovery, assuming you don't get a complication. So there's good and bad about everything. The other thing is it's interesting the way you've put it there, that speedy recovery, less bruising. You know, the in terms of the result, I think, as a surgeon, you often find the results are similar. And so if you've got a technology that can't give better results, gives similar results, but just has a slightly different complication profile, is it worth it? I guess the thing is to find someone who does both and see which one they plump for. Because you'll find that a lot of people who don't do Vaser just do the traditional, and a lot of people who do Vaser just do Vaser, and you've got to find someone who does both and see if they can make it suit you. But so there are reportedly good things about Vaser. There are other bad things about Vaser. It does take more time because you have to do the ultrasound energy before you do the liposuction. So it is a little bit more time with it. But good and bad, I'm probably not the right person to ask because you might say I'm biased because I don't do Vaser, but that's my view on Vaser. And speak to someone who does it and see what their results are like, and speak to someone who does traditional lipo, see what their results are like, and make a judgment on it. Is where I am. I don't think it's a bad thing. I think it's, especially if it does skin retraction, that's a very good thing. Will a navel piercing draw attention to or from scarring around the belly button? I'm not sure if I'm the best person to answer this, really. Oh, God. I've got an idea. I've just had an idea on the fly. I have just had an idea. You know what? I'm not the best person to answer this question. I don't know. Let's let the people decide. I can do a poll. Oh, I've just thought of this. Yes. No. Should I put don't know? Should I put don't know? Is everyone going to put don't know? Right. Let's have a live poll. Never been done. This is the sort of technology we're talking about. This is what happens when you meet a professional Facebook Live broadcaster. This is the sort of results you can expect. How's that? How is that? What's happened? I mean, this is pro. No, let's do it the other way. Huh? Live voting. Let's get some results on the board, people. Let me hear you say yes, no, or I don't know how you vote. I've not done this before. So, yes, I'm professional. Yes, I've got the gear. Not entirely sure how it works. What's happening at your end? Is there a way to vote? Oh, Lynn's commented. Lynn, hi. Lynn, comment. I mean, vote, please, if you want. You don't have to. I mean, this is you know, real nail biting stuff. I think you'll agree. This is very interesting. Though there must be some must be some delay because it doesn't look like anyone's voting. Okay, so you got to try things, haven't you? You got to try things. Okay, well, okay then. Well, I would say if I could vote, I don't know how to vote. Is there a way to vote? Okay. Hey ho. I would say it would draw attention to your belly button, to be honest with you, and it would draw attention to the scarring. Unless you had a massive piercing, I guess, like a big diamond or something. I guess that might cover it. Not even a big diamond, big thing. But oh look, Helen can't click on the vote thing, but I'd vote yes. All right. Well, I'm not going to do a vote again then. Oh well, thanks for trying, Helen. Oh well, I was excited about that. Is it not working? Oh dear, that's annoying, isn't it? That cough. Okay, well, yeah, Helen votes yes. Would a neighbour draw attention to or from? Actually, if you're going to be critical about this, you could argue that I haven't done it that voting very well because I've said, will it draw will a navel piercing draw attention to or from scarring around the belly button? Yes or no? So, oh god. So that's not. I'm asking the wrong questions. I should have said, will it draw attention to scarring? Yes or no? So just by saying yes, it will draw attention to or from. Oh, it's a shambles. Anyway, listen, it'll all come out when we do it live. Don't worry. So just to warm up. We'll cut this bit out. Right. Okay. Oh, someone's voted. Oh my God. Look at that. Someone's voted. The votes are in. 100% of the people say yes, it will draw attention to or from scarring around the belly button. I'm thinking people are voting saying it will draw it to. I don't know if I can change that. Anyway, right. Okay. Well, look, we're just trying the technology, but thank you for that vote. If that was you, Helen, thanking you. If it was yet another person, we've got 2 people who are wanting to vote. That's pretty statistically significant. I think you'll agree. So, yeah, we think it will draw attention to. I think that's what we're saying. That's what we think. So, yeah, that's what the people think. A belly button piercing will draw attention to the belly button. Right. Well, that was good, wasn't it? Let's get rid of that. Right. Remind me not to do a poll again, will you? Right. Okay. Just getting my PA. Okay, that was a good one. Thank you for that. So, what do I have to take my why do I have to take my acrylic nails off prior to surgery? I took mine and all my rings off, and for hygiene reasons will leave them off till totally healed. So this is something I now put in my pre-op instructions because it was a question we were getting a lot about the acrylic nails. Do I have to take my nails off? And the problem comes is, as so often the case, when you actually speak to the is it the organ grinder or the monkey? The organ grinder. I guess the organ grinder is the guy doing the thing, is it? Rather than the monkey. The monkey's just so when you actually get to speak to the organ grinder, you get a different answer. When you speak to the monkey, anyway, the point I'm making is that if you the reason I'm going to answer the question, why do I have to take nails off prior to surgery? Well, the answer is that one way that we assess your blood flow in your body is by looking at your nail bed, and by touching your nail bed and letting it blanch and letting the blood come back. That's the way we can look at the circulation, the color of your nail bed, and to see that the blood it's blanching and how quickly the blood comes back. That's a way we can assess your circulation. And if you've got nails on, obviously we can't do that. Now, the two things I would say, the other thing is the pulse oximeter, the little machine that goes beep that goes on your finger, reads the oxygenation of your blood, and that can't work if you've got nails on. So that's the reason why you've been asked to take your nails off. When you actually come to it, when you actually speak to the person who counts, which is the anaesthetist basically, who needs to assess those things, the anaesthetist, now first of all, they're often happy with a toe rather than a finger, because you can assess a nail bed with the toe. But also, to be quite honest with you, there are other areas you can assess the circulation. The eye inside your eyelid. You can other ways you can see how well vascularized you are. Similarly, with the pulse oximeter, you can put it on your earlobe. There are other places you can put it to get a reading. So it's actually not written in stone. I mean, we're not doing open heart surgery here. Most of the surgery is sort of like breast augmentation, things like that. So it's usually fine. But when you speak to people like a few layers back, if you speak to the pre-admission nurse or the person you met in the corridor or whatever, the easy answer is to say, oh no, you're not allowed your nails. And so often people will say, oh, no, you can't come in here if you've got your nails on. No, go on, off you go. Got to have the nails off, otherwise you'll die. So, but actually, when you get down to it, it's really just that, and it's usually fine actually when you speak to the anaesthetist. If you've got nails you spend a lot of money on, and they're all, I don't know how they stick on these days. They're all sort of, I don't know, is that what acrylic nails are? Are they glued on or something? But it's usually fine. And sometimes they just one, but you'll say, look, I don't want to just take one off. I look like look like a sort of guitar player or something. But that is why they say it. And the rings will be more for hygiene reasons, because of we don't really want jewelry in theatre, but for bugs. But also if you're going to have anything's going to swell, if you're going to swell, especially if you're having any surgery around your limbs, you don't really want to have your rings on, because if it swells with your ring on, that's bad. But yeah, it's probably good to take your jewelry off. Right, it's all kicking off in the chat. Helen can't vote. I'll ask a question. Go for it, Helen. You ask a question, girl. You go for it. Knock yourself out. Jan is in the house. You have competition tonight. CC Cat on High Live too. Are you kidding me? Well, answer me this, Jan, or I'll directly to you, CC. Have you got a live poll? Yeah, because I've just done a live poll, right? I done a live poll about whether navel piercing is going to draw attention to your belly button, and I got live results. I got 100% result on that. So that is what's going on here, my friend. Okay, this is proper scientific stuff. This isn't just willy-nilly thrown together. Thought through technology. It's all going off here. Acrylic nails, we've got a lot. Right then. So it is all happening here. We've got live polls, the lot. Helen's going to ask a question at some point as well. So, it's all to play for. I've got questions coming out of my ears. Look at this. I've got another one. Check this one out. When can I bathe after surgery, TT, and breast uplift? Right. You know what I'm going to do here? I'm going to pull out all my stops. I'm not messing about, guys. I am not messing about. That's what I got to say here, guys. It is a disclaimer, okay? Disclaimer. This is my own personal opinion, right? It's my own personal opinion, and is no, I'm going the wrong way, and is no substitute for an in-person consultation. Actually, or an opinion from a in-person consultation is probably not relevant for this. But so my view on when you can bathe after surgery, tummy tuck and breast lift doesn't matter. It's your surgeon that matters. So check with your surgeon. But what I do for a surgery, for a tummy tuck and a breast uplift, in fact, pretty much every operation that I do, just to disclose my secrets, it's not like pretty much every single operation, there's a dressing on and the dressing comes off after a week. Some operations you can wash with the dressing, or you can shower with the dressing on. with a, like for instance the breast augmentation. An uplift I usually put quite a lot of tape on, so you wouldn't be able to shower with that. You could get in a shallow bath, but not with a tummy tuck. So a bath's a bit different because it soaks. So shower is good if you were having like a breast augmentation, but a tummy tuck and a breast uplift would, for me, it would be 1 week. Dressings would all come off, and then you can do whatever you want, shower, bath, whatever. Shower's often better because the water's like circulating. So for me, it's 1 week, assuming everything's healed. If things aren't healed, because obviously it's quite a lot of surgery, a tummy tuck and a breast uplift, you might have little bits that aren't quite healed. You might have a little dressing. You have to check if they're going to use a watery dressing. You might be able to shower just the same, but it might not be able to shower if you have not got a watery dressing. So again, check with your surgeon, but my regime pretty much always I try and get people to be able to shower after a week, sometimes straight away depending on the dressing and what surgery they've had. So is the risk of DVT greater the more surgery you have in one go? Yeah. Yep. Oh, yep. So basically, the risk of DVT. I think there's more. Wasn't there more to this question? Oh no, that's the next one. The risk of DVT is related to several things. So the things like length of surgery is related to it. It's related to immobility. So things that make you immobile. So that's why airline travel. That's why Usher's wife got a DVT. She went to Brazil for liposuction. She was obviously on a plane. She was on a plane. She flew to Brazil. I think it was flame. She was just had a child, which makes you hypercoagulable, and she had surgery, and she ended up with DVT. DVT is a clot in your leg, by the way. Deep vein thrombosis can fly off into your lungs, called a PE, cause a pulmonary embolism, and that's very serious. So it is a serious risk of surgery. So the longer you're immobile, so the longer your surgery, the greater your risk of DVT. So yes, the greater, I guess, the more surgery you have in one go, the longer your surgery is going to be. So that's going to increase your risk of DVT. Lots of things we do to reduce it. We have these Flowtron boots on in theatre, which continuously blow your calves up. You have these stockings on. We give you heparin to thin your blood. And basically, the best thing is you get up and walking as soon as possible. And again, the more surgery you have in one go, the less mobile you're going to be. So that is going to increase your risk of DVT. Now, you could say, I don't know how it will work if you're having what's that? It's not rain. Oh my god, it's raining. You could say if you're having like a tummy tuck and a breast lift, say if you had them all in one go, I don't know what your risk would be compared to having it at different times. Because obviously you've got risks at different times. So I'm not sure about that. But anyway, so if you're going to have that surgery anyway, you could argue get it all in one go. But basically, the longer you're immobile, the worse it is. Yeah, I answered that. Water. Can you believe that it's raining? I can't believe that. What is the safest amount of time to be under general anaesthetic? I have been told I can have a tummy tuck, BR. What's a BR? Breast reduction, maybe. Thigh lift and eyes done, but I'm scared about that. Oh God, stuff's been going on in the chat. Sorry. Oh, it's Jan. Oh, I'll get to that. Sorry. I've been told I can have a tummy tuck, BR, breast reduction, thigh lift, and eyes done, but I'm scared about the length of time under. Is this the same? Is that related to the DVT one? I don't know. That is a lot, my friend. Tummy tuck. If BR is breast reduction, and breast reduction, you like your abbreviations, don't you? BR, thigh lift. What? Tummy tuck, breast reduction, thigh lift, and eyes. Oh my God. I'd be scared about that as well. I'd be scared about the length of time under anaesthetic. Not only that, how are you going to be afterwards? You're going to have a tummy tuck, you know, a breast reduction, you have your thighs and your eyes. Oh, Lord alive. That's a lot to have in one go, I would say. Oh, man alive. And also, is it one surgeon? Flipping heck. How's, by the time they do the last operation, I'll be exhausted. I think that's a lot to have in one go, in my view. Full disclaimer, it's my opinion. And if someone's offering you that, then maybe they're okay with that, and maybe they're used to doing big long ops like that, and maybe they've got a team, of people. So you could be maybe having your tummy tuck, and then someone's doing your eyes at the same time. That would be a doer. So then maybe they've got a team that sometimes people do that. Um, so you could be having your breast reduction while the thigh lift's going on or something like that. That's possible. But nevertheless, so that's one thing, the length of time of operation with the DVT and stuff, but also it's the recovery. You've got to think about it. Your thighs are going to be uncomfortable, your breasts are going to be uncomfortable, your tummy's going to, and your eyes. I say that's a lot. I say that is a lot to do in one go. So, in answer to the question, what is the safest amount of time to be under general anesthetic? You know what? You can have long anesthetics. I used to do these breast reconstructions. They could take 10 hours, 12 hours under anesthetic. These days, anesthetics are very safe. And they do say it's a bit like flying. It's the takeoff and landing that's the problem. When you're in the air, it doesn't matter quite so much. The danger periods for sort of crashing are when you take off and when you land. When you're, having a flight to Italy, versus a flight to Australia, the risk is not proportionate. We're making that, because it's the takeoff and landing where the risk is. So, and it's similar with an anesthetic. So it's not so much the safety of the anesthetic, although obviously the flight to Australia is got more risk, but it's not as proportionate because you're in the air and it's just cruising. And it's the same with anesthetic, cruising in the middle of it. I think I made that quite like that analogy. Hope you like the analogy. Give me a thumbs up if you like the analogy. That's what they say. I don't know. I can't see if you're giving thumbs up and stuff, but maybe that's something else. Is that YouTube or something? Anyway, yeah, I'd be scared about all that operation too, to be quite honest. Have a real think about how you're going to be post-op. What's going on here? Competition. Jan, I missed what you said about CC being on. I was plugging my earphones in. Well, Jan, if you missed that, you missed my poll. I did a poll, Jan. And, if you want the latest technology and the latest up-to-date stuff, obviously, this is where it's at. I'm coughing. I am coughing, aren't I? I think it's the nerves, Jan. I think it's the nerves because I wasn't coughing that badly a minute ago. And now I'm on here, I'm coughing more. Thank you. So, excusez-moi. Cracking on, what we got? Oh, God, not on to the last question yet. After surgery, this is fantastic, these questions, I've got to say. That I'm very, very grateful for this. After surgery, how soon before you can apply silicone tape and gels? Right, so is this, yeah, this is, I should have linked my scar questions together. So basically, the main thing with scar, I'm going to talk about this in a minute with that machine that you can get off eBay. The main thing with scar is time. And for me, I think massage and moisturizing is good to help scars to settle. Silicone tape and gels are quite expensive and they are good for hypertrophic scars, red raised scars. They market them and full disclosure, we sell them, and they market them as scar reduction gels and creams and things. But there's not that much evidence on normal scars. Normal scars will settle whatever you do. We have got one with little ball bearings, which I think is good to give the massage. I think the ball bearing is good for the massage. But silicone is really for scars when they're red and raised, hypertrophic or keloid scars. And those scars don't become hypertrophic or keloid for like a couple of months after the surgery. So you don't really need to start applying silicone gel and tape early on. I normally say to people, leave your scars alone for, again, full disclosure, this is my view. I leave them for 6 weeks. I see you at 6 weeks, and then we talk about scar management, whether that be silicone, whether that be the gel, massage, moisturize, whatever. So I normally start about 6 weeks. If you're asking the question, how soon can I apply the silicone tape and gels? Well, I normally say don't massage for 6 weeks because the wound is under tension. So you don't want to go messing with it early on. If you're just going to put some silicone gel on or silicone tape on, you could put that on earlier. You could put that on after a couple of weeks, but I would worry that it's a bit of a waste personally. I don't know if there's any evidence to say that you should start it when the scar is looking okay, because it usually looks okay to start off with. And if it's going to go keloid or hypertrophic, it takes a couple of months to do that. And don't think, oh, if I put the silicone gel on before, I would have stopped it. I think you just have to treat the scar as best you can. But in the first 6 weeks, I normally personally leave it alone. There's nothing to stop you, in my view, from putting some silicone tape and gel, as long as you're not massaging it and sort of, putting tension on it sooner than that. But I wouldn't recommend it. We talk about that at the 6 week mark. And the main thing is time. Scars, really, time. I'll talk about that in a minute with the machine on eBay. What's going on? So, after big weight loss, is it possible to go from a 36F to a 36B without any implants? I have a lot of excess skin and wouldn't want implants if possible. Yes, that is very well. Hold on a minute. First of all, there's two things with the breast. There's the size and the shape. The size implants is really good at addressing the size, but the thing it's really good at in terms of addressing the size is making them bigger. So if you want to make them smaller, implants is not good at that. Implants makes them bigger. So I don't even think I would be thinking about implants at all, because you want to be smaller. You want to go from the F to a B. The shape is a lift or a reduction. So a lift and reduction are the same sort of thing. Similar surgery, but obviously a reduction, they're made smaller, and a lift, they're about the same size. So if you're a 36F and you want to be a 36B, then it's a breast reduction you need, not implants. And as you've said got a lot of excess skin, and a breast reduction / lift removes that skin. That's the lifting part of it. And then the reduction part of it is going from cup size down. Now, if we go from an F to a B, I'm not sure if that's going to be realistic. F to a B is quite a big jump. C, D, maybe, but a B, it's quite. And the other thing is, a lot of people say, I want to be a B, I want to be small, but especially if you've got a 36 back, a B cup might not look right on your frame. So you've got to think about, I mean, again, just when I talk to people about breast reduction, I talk about making the breast in keeping with your frame. Obviously reducing it, definitely, but I can't guarantee a cup size. And people have in their minds, oh, I want to be this cup size. But actually, if you think about it, on a 36 back with a B cup, that might be quite lacking in projection. It might not be a good shape. You have to get a good shape, I would say, is more important to get a nice shape, obviously smaller, obviously lifted. But you need to have it sort of like a pyramidal shape, with a nipple on the apex, a nice proportion. That's the important thing. We don't have something in theatre that says this is a B cup, this is a whatever cup. And I think, so I think B cup might be a bit small on your frame. Obviously, I'm saying that without even seeing you at all. But the other thing is, going from an F to a B cup is quite a big reduction. And I'm not sure if that would be possible, because when you do a reduction, you have to keep the nipple on a stalk of tissue, and that carries with it a certain amount of volume. And so when the bigger you are before, the bigger you are afterwards. So, I'm not sure if that would be feasible to go from an F to a B. But again, need to talk to your doctor about it. But the question you're asking about, can you do it without implants? Absolutely, yes. Definitely do it without implants. Don't go for implants if you want to be smaller. Here we go. Oh, last question. I've got a thing that says last question. I used to have one, didn't I? No, I haven't got one. Okay, this is the last question. Full disclosure. So, why did I say full disclosure? I'm looking for my last question thing. Get in now, people. If you've got a question, get in. Get in. What is? Oh no. Do ultrasound products reduce scar tissue? So this is someone, they've sent me a link to I'm saying eBay, maybe it wasn't on eBay. Anyway, a machine that you can buy, which says it reduces scar tissue using ultrasound. The main thing, and the whole sort of science behind scars and scar reduction and what have you, is it's often not very scientific. And often what you'll find is that people will show you a photo of a scar and they'll say, look, we've used this machine on it for 6 months and look how good it is. It's brilliant. It's disappeared. And you get people say, oh my God, that machine was brilliant. Look at that. My scar has disappeared. I used that machine. It's fantastic. Fact of the matter is, scars often settle. You know, they often disappear. Well, maybe not disappear, but they often settle. And what the people who make the machines need to do is to do half the scar. They need to treat half the scar, a tummy tuck, treat half the scar, and not the other half of the scar. That would be impressive if they can. That's, you know, that's like a randomized controlled trial. So you'd randomize it. Randomize which half you use. You do have a control. It's the control bit that you need. So the control bit is the people not having the treatment. If you've just got people on the treatment, you don't know if it was the treatment that's caused it or something else. In this case, time. It's because time makes all scars settle. So that is the problem with, to be honest, all the scar stuff. For me, I think so. The main thing is do no harm. And if it doesn't do harm, then that's a good thing. For me, massage is good. Now, ultrasound, similar sort of thing, the massage, but a bit cheaper massaging because you just use your hand for that, whereas this is a machine. So I think massaging, time, moisturizing, the things that have been proven, silicone has been proven to be helpful in hypertrophic or keloid scarring, but other stuff is not. Well, you'd have to look at the science behind it, but I'm not aware of any good science that says that ultrasound helps scars. The main thing is time, let it settle, and it will settle in time. And as long as you're not doing harm, fine, but don't go spending a lot of money on things and sort of putting your hopes on it. When in fact, I would say I wouldn't recommend that you spend money on it. Put it like that. If you want to, and it doesn't do harm, fine. But go in with your eyes open. I won't particularly recommend it. We had a peak earlier with the piercing. I mean, I was quite happy with the piercing the piercing pole, but I'm out. I mean, I had a lot of questions there. 10 questions I had. I've gone through 10 questions. I think you'd be here. Oh, look, Jan's in. If you bought everything people said you would be skint. Absolutely, Jan. Absolutely. Especially stuff with scars. It's very expensive, scar stuff. Scar cream, scar gels. They're expensive. And for me, it's the massage, moisturizing, looking after yourself, drinking plenty of water, staying out of the sun, not smoking. All these things are looking after your skin. Don't go, necessarily buying a machine that may or may not work. So I'm out. Full disclosure, I'm out of questions. So I'm going to be back next time, 7 o'clock next week. If you have any questions, fantastic questions tonight. If you want to do a poll, I'm happy to try it again. Let's give it another go. We did get a vote on this one, so I think we can do better next time. I'm going to look for an angle for a question with a poll. I might phrase it slightly better than saying, would it draw attention or not? Because then that's not really a yes, no answer, but I'll think it through a bit more next time. If you've got any poll-like questions, then please do ask. Early night. Yeah, it's an early night. It's an early night. I'm going to go and watch movies for men because I am home alone. Got the door open, if you notice. My family have left me. They've gone away, but they'll be back tomorrow on sort of holiday. They haven't left me, so they're back tomorrow. So I'm going to get the deep fat fryer on. Movies for men, lager and lime. Happy days. I'm not going to get a lager and lime because I was operating earlier. Okay, I'll have a cup of tea. Movies for men, cup of tea, and the deep fat fryer. And that is me. And then my wife will come home tomorrow and tell me off for stinking the house out. So that's my night. Let me know what you're doing tonight, everyone. Comment below. That's what they do in YouTube. I can't do it like they do it. Yeah. Anyway, doesn't matter. Don't mind what you're doing tonight. I'm going to go and do said things, and I will see you next week, Tuesday night, 7 o'clock. Got any questions? Facebook me, messenger me, or get in touch. And Jan, you have single-handedly carried the comments, Jan. Gold star for you. And I will see you next time. Thank you for your input and your comments. And I look forward to doing this all over again next Tuesday at 7 o'clock. Good night.